about your life, your symptoms, and how long you have been dealing with.
I've been dealing with fractures since 2015,
Okay.
and at first they were painful, and that's what led me to get some kyphoplasty done, which immediately took the pain away and allowed me to be more active again. And it's just continued to get worse. Harder to walk, harder to
Now,
do things.
yeah, 1 to 10, how bad is the pain? Describe it to us. Because people who are not in pain, sometimes they don't understand what that really means.
In the morning, I am normally probably 3 to 4. But by afternoon, by like 3 o'clock, 4 o'clock, I am definitely a 7, 8. And sometimes by evening, I am over 10.
Every day?
Almost.
Almost every day.
I have some days, depending on the weather, where I'm better.
How long have you and I have you been meeting? Has it been almost a year or so?
No, it's been 2 years.
2 years now.
Yep.
So, and in 2 years we have been watching you, we have been trying all the other treatment. And the last time we met as well, we talked about the surgery, if you remember. And
Yep.
I'm just going to turn around. You have multiple what we call compression fracture. We did have done kyphoplasty, but as well you have scoliosis. And your pain from the location seems to be corresponding to your scoliosis here. And, but I didn't jump to surgery. You remember that we have been going on for 2 years. I did not, I tried really hard not to even talk about surgery to you.
That's correct.
Yeah, why is that? Why do you think why I tried to avoid surgery at any cost, like we can?
I have just told everybody that I talked about regarding you. You're a very different neurosurgeon. You don't push anything, and you are extremely kind.
Yeah, thank you.
And extremely compassionate.
Yeah, thank you. No, but the medical reason why I try to avoid the surgery is because of your soft bone. And it's because that if you have soft bone, usually the healing process is more extended, and even if you fix one area, you already have broken bone in other areas. Sometimes those broken bone can be aggravated. And I encourage you as well to seek second and third opinion. You remember last visit?
Absolutely.
So tell me, how did that conversation with the other surgeon go?
I've actually seen 3 other surgeons, and they've all just said they wouldn't even touch me.
Yeah, and did they tell you why?
That the complications and the recovery would be at least 2 years.
Yeah, did they tell you what kind of fixing you would need? That what kind of surgery they would do that would have such a long recovery and complication rate?
Actually, they didn't, other than to just say it would be open back surgery.
Yeah.
They didn't talk to me long enough
Yeah.
to even talk about it. They just looked at the MRIs and they just said, we won't do it.
Yeah. And I'm going to tell you a sad insider story from our neurosurgeon. You and I have been talking for a long time, for many years now, and so on. The sad story is in this situation like that, doing surgery on you, it is not safe for our practice because you have higher rate of complication and we don't want to have complication in our practice. We surgeon. We know that if this goes on, you will be wheelchair bound. And if you're wheelchair bound, even though it's not our complication anymore, your heart and lung will literally decondition, will shut down. And then we say in average life expectancy of anybody elderly who stopped walking is actually 6 months. Unfortunately, when we don't walk, you can silence it if you like. Unfortunately, our body is made to walk. And if we don't walk, for whatever reason, doesn't really matter for what reason, our lung, heart shut down. But on the other side, my colleagues who did not give you option of the surgery, they are right. Open surgery would be 6-7 hour surgery, And in your situation, your body takes a lot of injury from it, and recovery is much harder. But and as we talked about that, the idea is here: if you can walk, if you can live with it, truly live with it, we shouldn't be doing surgery. Can you live with it truly?
I've gotten to the point where I'm tired of it.
Yeah, so, and there are lots of people in your situation where open surgery is truly not an option, because yeah, you cannot live with it. It's not good for you. It's going to decondition you. But open surgery is not an option. The only reason I can give you the option is that the surgery for me is actually 1.5 hour surgery usually, with about something like a half a cup of coffee blood loss. So this is reasonable amount of surgery. Obviously, you're not fixing everything, and I have been emphasizing so many times that obviously the rate of complication is higher in your situation, and we are not fixing all your problem. And if you can live with it, you should live with it, but at least minimal invasive surgery is an option. So you have the choice in combination of us discussing risk versus benefit. And unfortunately, most of surgeons, all they do then in a situation like that, they just send you away and say, just no option whatsoever. And it's that no option for lots of patients in your situation means like living until the end of their life with the pain. And that, I don't believe that's on our side is a acceptable kind of situation on our side, on the surgical, that just push the patient away. So I know you have lots of questions. Do you want to ask some of your, because if you have a question, lots of patients in your situation have the same question. Do you want to ask some of your question that I can answer it as well? So, and that help maybe people in your situation to have a good realistic expectation what the situation is and what they can expect you. Any comment or question for me?
My main question is, am I going to be able to move afterwards like I can now?
Yeah. Now, I can give you the statistic of my patient in the past. Obviously, I don't see in the future. You are not the first patient I'm doing this kind of surgery. But all the thing I told you about the surgery, the risk versus benefit, and all the thing about complication, I just have to give you a range of what the possibilities are. So you have a good understanding about, we call it consent decision for that reason, that I give you all the range of things that can happen, good or bad, and then you can make a decision. Now, I can tell you statistically that in average, fixing this problem for you, whereas open surgery is literally can be 7 to 10 hour surgery, in my hand is 1.5 hour surgery, whereas after open surgery, people can lose 1 liter or 2 liters of blood. We lose usually half a cup of coffee to a cup of coffee blood, which is, everybody can tolerate that. And my patient usually walk within 2 hours, 2 to 4 hours after the surgery. With your scoliosis, with your kind of situation, it may take a little longer. My patient usually stay in the hospital one night. Again, your situation is you have soft bone and you have to put you in a brace. It may take longer. And my patient usually, after in your situation with this kind of problem, it takes them a month or two before they can do basic daily activities, because your situation is much more severe than my average patient. But my colleagues are right. Open surgery, it may take more than 2 years for you to recover, but we have seen that my patient bone grows usually after 4 to 6 months. But there are risks involved. Absolutely no surgery comes free of risk or with any kind of guarantee of success. And in your situation, there is definitely risk that the levels above or below cause problem. So what we are fixing is a segmental, meaning one area that we think is giving you most of your pain, to correct that area and hope that most of your symptom goes away. Okay?
Yes.
And as long as this is acceptable, that level of the correction, which is just a segmental, and where I think is most of your symptoms coming from, that is something I think we should give the patient the choice of understanding and help the patient to make the decision. Not pushing the patient in any ways, but just not giving the patient, I think today in 2022, where we have minimally invasive option, not giving the patient the choice, I don't think it's a good way to go. I think we should explore all ways, not only the open old-fashioned way. And that is why I think lots of people don't get the care they need. They don't get any minimal invasive option, even though we know we can make a big surgery small, less risky, and we are just pushing them out of our doors. And I think that is the message I want to get out, that there are options, that the patient should look into all options. Okay?
Yep.
Any question for me otherwise?
Not really.
Okay.
Do you know if this might help the neuropathy in my feet?
Yeah. See, part of that's actually a very good question. Neuropathy is a term reserved when the nerves are bad from inside. I cannot fix that. But sometimes we wrongly classify something what we call radiculopathy, which may feel the same to you, as neuropathy. Meaning radiculopathy is when the nerve is pushed from outside, neuropathy is when the nerve is damaged from inside. And I can fix the radiculopathy where we take the pressure off, and many of my patients, they wake up, the first thing they tell me the symptoms in the legs are gone. Many times when they wrongly classify as radiculopathy to neuropathy, people come and tell me, yeah, I have been told I have neuropathy. I do the surgery and they wake up and the leg problem is gone. That means that even though the symptoms are the same, this wasn't a neuropathy from the start with. It was a radiculopathy that can get better with my surgery, but I cannot go inside of the nerve and fix them from inside.
Sure.
Okay?
Yeah.
That was a very good question.
Oh, thank you.
Okay. Anything else?
I think that's it.
Okay. Well, thank you so much for the